In the span of 1 year, the health experts have deciphered some of the most puzzling questions pertaining to the novel coronavirus, be it related to how it invades our immune system, or how it spreads. However, one of the most governing questions that remain unanswered is how much population may have been reinfected by the SARS-CoV-2. Now, the apex medical body of the country, the Indian Council of Medical Research, has tried to decipher this mystery. The study by ICMR states that so far approximately 4.5% of reinfection cases have been detected of the 1,300 people investigated in India. The 1,300 subjects were shortlisted through the data collected by the ICMR laboratory of over 80 million people tested between January 22 and October 7, 2020. All the selected study subjects were investigated over telephonic interviews. This is an averaged out figure over a period of about 8 months, January to October 2020, which will vary with behavior and intensity of epidemic, said Dr. Balram Bhargava, Director General, ICMR, to the Hindustan Times. Moreover, the ICMR has also provided a new definition of reinfection as any individual who tested positive for SARS-CoV-2 on 2 separate occasions by either molecular tests or rapid antigen test at an interval of at least 102 days with 1 negative molecular test in between. To develop this definition, ICMR analyzed more than 43 investigations, which included cohort studies, as well as randomized controlled trials. The team further examined the properties of SARS-CoV-2 viral RNA from the upper respiratory tract, and through this, the viral shedding was found to be 17 days, while the maximum span was noted at 83 days. Moreover, in some cases, it was also found at 104 days. After going through all these set of database obtained from different studies, the team came up with this aforementioned definition of reinfection. However, the study did not conduct any genomic examination of the 2 infections, to completely prove the case of reinfection in an individual. As per the authors, the study was executed to create an epidemiological case definition of possible SARS-CoV-2 reinfection and to further establish surveillance systems. The study cites though the chances of reinfections are rare but possible. The chance of reinfection as calibrated with the global level is only 1%. The U.S. Agency Center for Disease Control and Prevention takes into account the duration of at least 90 days between the 2 infections. Moreover, it also conducts a genomic analysis of the reinfection for confirmation. The team asserts that even though the chances are relatively low, individuals must continue to follow all the preventive measures like wearing a mask, maintaining physical distancing, hand hygiene, and avoiding mass gatherings. Moreover, another new study published in the British Medical Journal has highlighted that people who are above 65 years of age are said to be at the highest risk of acquiring the infection again. This may be due to the waning immunity, and other underlying conditions, which them more vulnerable to getting reinfected. The ICMR study has been published in the journal Epidemiology and Infection from Cambridge University Press on March 26.